Good morning and welcome to our webinar today. This is Patrick Heister. I'm joined by Marcia Kent.
Good morning, everybody.
And we are excited to kick off this year's HR webinar series that we are providing for all of our client companies and a variety of other HR participants who are interested in attending. So this year, we got together with our account management team, with our marketing folks, and really talked about what might be of most interest. And so we're very excited, Marcia and I, to share some of our process and experience in working in organizational development. So what we're going to focus on in these 4 webinars is some of the organizational development challenges that we get the opportunity to work with our clients with, but at the same time to really challenge our HR practitioners who are participating to think about your organizational challenges. Some of the interventions that you are doing all the time or potentially could do or sometimes aren't able to do. So we would like as much as possible to bring it home to you all. One of the ways that we're going to do that is we're going to share some specific case studies of opportunities that we get to work with. At the same time, we invite you all to share in any way that you can some of your own situations, your questions, and your challenges. Since the format of the webinar excludes any at least verbal participation on the phone and during the webinar, we may have as many as 50 to 100 registrants at times. So it's not practical to have people be able to just chime in, although you are able to type in questions, and we'll try to be vigilant to look for any questions that you type in at any time. So we would like to encourage folks to contact us between the webinars, before the next webinar, after the webinar, directly by email, through the account managers, any way that you want to contact us by our voicemails, and we'll have both our email contacts and our phone numbers at the end of the webinar. To share any questions, any thoughts, any additional information that you have, and as much as possible, and being discreet, we can build that into some of the webinar series that we'll be presenting. So we really want to welcome you today and hope that this provides some valuable information, both that you can utilize and both some things to think about. Anything to add, Marcia, by way of introduction?
No, I guess the only thing, as Patrick and I were putting this together, we really wanted to get at the heart of what are the types of organizational development challenges that keep you up at night or give you heartburn over. And our hope is, as we go through this series, we might ignite some ideas of how you might use some of these tools, either for yourself, if you are in the realm of working as an OD practitioner, or if you partner with somebody, so you know what types of questions to ask on how you might work with someone.
So our first webinar today is really going to be an introduction to this entire series, really looking at OD in your organization. Although it is an introduction to the series, it's packed and chocked full, as always, of valuable and important information for you, a lot of things to share with you. So it should be a fun introduction today. And just to go over our plan for the series, we've organized this along what might be a typical organizational development intervention process that we do. So from the very beginning, what are the types of organizational challenges that we get called in on? And then what do we do about that? How do we gather the information? How do we decide what to do for that information, for that particular intervention? In May, we'll have session 2, which is really about the next step and our standard process, if there is such a thing. Most of the time, we suggest doing an organizational assessment. So rather than designing an intervention just based on information that we get from folks that are feeling the challenge or in pain, we optimally like to go and talk to the critters who are in the situation, whatever the challenge is, and find out from them what's working and what's not. So we're going to focus on the assessment process, how to formulate that. What do we want to find out in an assessment? How do we get to that information, and everything that happens around that. The third webinar will be Wednesday, August 17th, and that will be on the art of report writing. So when we've done an assessment, again, our standard process is to write a fairly thorough report that feeds back to the organization what we've found, so the specific data that we've heard from people. Here's what's working, here's what's not working, the root causes of whatever the distresses are, and then also using our systems theory, what's an analysis of why is this happening, or how does this fit with the organization's development or the systems. And so really taking a systems perspective, and then what do we recommend. And then finally, the fourth webinar will be on the action plan. So based on the assessment, the analysis, and recommendations, then what are effective interventions to really help change the situation at hand. So that's kind of the overview of the whole program. As I said, today we're going to be focusing really on the first stage, which is the referral process. We had invited feedback from you all about what are the things that keep you up at night. So please keep that in mind as we're doing the webinar today. We have a few polls that can get to that, but we can't get a lot of details. We really want you to be thinking about what are some of the particular challenges that you experience either all the time or right now or a year ago or that could be coming up.
And the format will be that we are going to share with you today 3 specific case studies at the end of the webinar. And we will use those 3 case studies consistently throughout the series so that when we talk about report writing or doing an assessment, we'll tie it back to those particular case studies. We might introduce some additional samples or case studies. So we just want you to know that we will be using those consistently through the webinar series.
Yeah, and again, we are happy to take input from you all and either include questions that you have or situations, but we've chosen 3 particular cases that we can really follow through this process. 2 that fit really well, and 1 that's an exception, as there always are, dealing with human beings.
Okay, the first thing that we wanted to talk about is what's the difference between training and an organizational development assessment or an intervention? And the reason we wanted to talk a little bit about this is oftentimes when Patrick and I get a call from a client that's in distress and they're talking about a problem, what they might say to us is, look, we have a team that's having some troubles, there's a lot of trust issues, there's poor morale, we're getting a lot of complaints, can you come in and do a training on teamwork? And it's really important to understand the difference between organizational development and training and what types of results those activities will yield. Because oftentimes, especially for our clients that have used Minds and Associates to do their EAP, since there are training hours included in their contract, it's very tempting to want to put in a training to address the problem. So when we think about training, typically what we're getting a request for is to do something to address some of the symptoms that they're experiencing, gossiping, backstabbing, lack of productivity, poor morale, complaints. And it tends to focus more on an individual in the training, and it will usually suggest some specific skill sets that that individual may or may not want to implement. So it tends to be specific in content. It usually has a short shelf life. Just to put it in perspective, I've heard that the shelf life of a 2-year MBA program is 3 to 6 months. So you can imagine what a 1 or 2 hour workshop might be. Now this isn't to say by any means that training isn't effective or it's not important or it doesn't have value. I think the point that we want to make is that when a client is really struggling with significant systemic issues that also tap into team dynamics and human behavior, more often than not what they really need is an organizational development intervention. And a training or a series of trainings might be part of what they need to do in addition to some other recommended steps. So organizational development interventions really try and identify the root cause of the problem. It takes into account systems that are in place around workflow and workflow efficiencies, and it really looks at that intersection. So for example, if there are constraints or bottlenecks in a system, and then they see people that are frustrated and short with one another and irritable and unskillful in their communication, if we can understand where the system has bottlenecks and constraints and address that, it could relieve 80% of these other human behavior skill issues. It tends to be long-term. It's not uncommon for Patrick and I to work on interventions that are anywhere from 6 months to 2 years in duration. And as I said earlier, training can often be a part of the recommendation. People might need to learn how to manage conflict effectively. They might need to learn how to communicate more skillfully. They might need to learn how to do more creative problem solving as part of it. So hopefully that's clear on what the difference is between training and OD work. Patrick, is that any questions about that?
Well, just something that I would add that I'm thinking about as you're talking about that is that hopefully the response that you all get, that our client companies and any other clients that might be calling us get, a warm and friendly response from us. Certainly our account managers, Peggy and Brittany, and Marcia and I strive always to be friendly and receptive. There are times that you may feel a little bit of pushback on this issue in particular. So if you call Peggy or Brittany and you say, boy, we want a training on conflict resolution, I think their response is always going to be sure, and then talk to Patrick or Marcia about this. And sometimes if you say, well, there's been a lot of conflict in this group, and people are really at arms against each other, then that's when we may sometimes push back about, is training really what you need around this issue that Marcia is saying? Is it really what's needed for this group? This is the way that I put it, and Marcia, you might be able to help me with a better word, but if we're going to do a training to try to attempt to deal with something that really is an OD issue, we may agree to do that if in consultation with you all, that's really the direction of what's needed. In my view, as a training, we need to then stay somewhat superficial, that we're not going to dive into the issues at hand, because I believe that one of the worst things you can do is to stir up all kinds of trouble that you can't close. And in a 1.5 or a 2-hour training even, you're not going to be able to really bring up deep-rooted conflicts that people have with each other, get that on the table, and be able to close it. So better not to address it and just give people skills. Does that make sense, Marcia?
Yeah, it does. And it's a nice lead into the next slide. I tend to use a visual metaphor for people around training versus OD work, which is training, and this is in no way meant to undermine the value of training. However, if a work group is really dysfunctional and they ask us to come in to do a training, it's almost as though we're putting a Band-Aid on a situation that really requires a tourniquet or something more dramatic than the Band-Aid. And so to Patrick's point, we don't want to set people up, frankly, to fail by creating a situation that could open up areas of concern and not be able to address them in a way that provides healing and closure and skill sets for moving forward and really addresses the system's issues. So that leads to the next question, which is, well, how bad does it hurt? And when we're working with our clients, one of our tasks is to really help them identify the level of pain. And it's important for us to keep this in mind, because oftentimes these are not things that are planned for. They're not things that people would have anticipated, perhaps. And so it's important to understand, what is it costing you personally? How much of your time is being spent on a particular work group or a particular department, or even a toxic individual? What's it costing you in terms of your emotional well-being, your ability to focus and take care of what you need to do? So we really want to understand, how is this dilemma, this challenge in your organization actually affecting you? It's important to analyze and look at, what's it costing the organization? What is it costing them in terms of either lost productivity, turnover, miscommunication, inefficiencies? What's it costing the bottom line? How much profitability is being lost as a result of this problem not being resolved? Another way to assess that is, what will it cost if you do nothing about it? If this problem persists and prevails, and you do nothing, what will be the cost? It's important for us to work with you to understand, well, what have you done in the past? What's worked? How have you tried to solve this problem? Did you have the right players involved? What worked and what didn't, and what got in the way? These are ways to help us identify with you how severe is the pain. And the reason that we're bringing this up is oftentimes this isn't budgeted for. When problems erupt like this, there wasn't a budget in place. And so what we have found is that, however, when the pain is bad enough, people will do what they need to do to move away from it. And so we want to be able to assess how bad does it hurt.
At this point, we wanted to just get some interaction if we can, and we have a couple polls set up just to get some of your thoughts. So we're going to ask you a very basic question just to start off with. And that question is, what kind of resources do you have internally? So the poll question will be, do you currently have an internal OD resource in your organization? And it's mostly a yes or no question. So I'm going to, so those of you that have a keyboard available, we're going to ask you just to go ahead and give us some feedback about this, and we'll get some idea from you all. So hopefully at this point you're seeing the polling question, and we'll give you some feedback. I think you should be able to see the poll. So we've got about, we'll give it another minute here. With 71% people who voted, we've got about 40% that do not have an internal resource of some kind, 20% do, and 40%, our third choice was I'm it. So you are the resource. So again, what we want to do is really to appeal to your own particular resources and share everything that we can to strengthen you in that. So thanks very much for taking the poll. That's closed at this point, and we are going to go on. We have another poll that we'll ask you in just a minute.
So we asked you how bad does it hurt, and then where does it hurt? The where it hurts has everything to do with the signs and symptoms that we hear about when a client is calling us asking for our assistance. So some specific indicators of problems could be high turnover, increased absenteeism, lawsuits, potential lawsuits, active lawsuits, trying to minimize lawsuits, and that could be everything from hostile work environment, harassment, violence in the workplace. Increased complaints can be either internally or even from vendors. We've heard of complaints on compliance hotlines as a way of getting the information to upper management to pay attention. Loss of revenue is certainly an indicator. It's important to understand or assess how much of loss of revenue could be related to dysfunctional work teams or problems in the work environment. Decreased productivity. Is it taking people longer to get things done? Are they not achieving the quality results? Are they just not producing the volume? And this next one is a really big one, workaround accommodation. So rather than dealing and resolving the problem head on, it's not uncommon for employees or a department to do a workaround to find another way to get around the problem. And some of these workaround accommodations can be significant in terms of the dollar value that they create and in terms of the amount of stress and angst that they produce for the employees. It can oftentimes send a message that, if people are not pulling their fair share and you're doing workaround accommodations, the message that it can send is we're willing to reward the non-producers by giving them less to do, and we're going to punish the producers by asking them to pick up the slack. That could be a workaround accommodation. And another big one that we've seen, especially in light of the recession in the last couple of years, has to do with difficulty around change and transition. And this could be either from mergers and acquisitions, it could be from a decrease in the workforce and people having to be responsible for creating the same result with less resources, change in leadership. So this one is I would say almost often is an underlying theme of a lot of the interventions that we do.
And something that we uncover oftentimes in the process where it may not be the most obvious thing. just one added piece on the workaround accommodations, and this is something that you all know, but certainly in the larger organizations that we work with that can afford to sort of ship people around to different facilities or different departments, rather than dealing with performance management very directly, people kind of either self-select out or get shipped off to another department. And then, funny enough, we get a call for that other department. So it's shifting around toxic workers. And you know, I know sometimes, especially in a large organization that has bidding processes where people can bid out, you can't always necessarily stop people from moving from one area to another when they're disgruntled with that area. But it really calls to mind the importance of performance management and dealing directly with those kind of issues. So once again, we're going to stop and do another poll now. And we had requested some feedback, and it'd be nice to hear from you all if you were actually saw this on the invitations. But we wanted to get some sense of what were some of the organizational challenges that you all face. Since we're limited on our poll, we had to condense these down. But we'd like to ask you now, what are some of the your top organizational challenges that you face? So our next polling question is, which of these issues, so we're going to give you 5 choices from this list, which of these issues has been or is the biggest OD challenge in your organization? So, oops, hang on. Okay, so we've got 5 choices of OD issues: turnover, poor morale, difficulty with change and transition, potential lawsuits, and decreased productivity. So again, if you could, those of you that have a keypad, if you could give us one of these 5, it'd be great to hear from you what some of your particular challenges are. So good, we're getting some good variety. I'm not sure if you get to see the results or not. In theory, you should be able to see them, and I hope you can. But if not, we're going to go over it. So we've got about 86% of people on the call have voted. I'm not quite understanding the percentages that we've got, but we've got 17% people said the turnover is an issue. It says 100% say poor morale, so that's the quagmire to me in terms of percentages. But somehow that one got selected, and we'll come back to that in a minute. 33% have difficulty with change and transition, and 17% potential lawsuits, and 0% have identified decreased productivity as one of the organizational challenges. So again, it seems like something's a little funny on the poll, but to go back to poor morale, I think that's one of the things that we sense, that we feel, and that intuitively calls us to some type of alarm. And it certainly as HR folks, you hear about that. People come and they talk about feeling discouraged in their job, or they're ready to quit. They just can't fix these situations. And that's often a major cause of why we're called in. I wanted to share quickly, we had one intervention that we assessed, and there were really some morale issues in a particular team. This was sort of an IT sort of team situation. And the leaders of the organization really struggled with that word, and it was, I think, eye-opening for us, for Marcia and I, to really deal with it. They said, well, you know, people talk about morale, there's poor morale, what does that mean? And they really wanted us to get specific with folks about what they mean by poor morale. we dove down to second layer, and really the issue for this team was that people were not feeling empowered in their jobs. Similarly, there was some pushback. Well, what does that mean? What is it they're looking for specifically? So it was great because there was a lot of interaction in this, and this organization really pushed us to be more specific about some of the language that we use.
And like in that situation, like others, it also did have to do with systemic issues about how decisions were made, the layers of approval before somebody could make a decision that slowed the process down. And so it was really important to look at the system issues that were in place around decision making and scope of authority that had a part to do with the low morale in that group. So I noticed that a number of people talked that there are some challenges around change and transition, and this really is a nice lead into this slide that asks, what assumptions do we make about, really, what assumptions do we make about the way that we do business? And we see some themes that come up often in these organizational development assessments where there are certain assessments or assumptions, that are made about loyalty. So for example, we reward loyalty over everything else. And if we assume that loyalty is the most important value, how does that affect decisions, promotions, demotions, sharing of information? Are we a culture that values performance over everything else? And what does it mean to move from a loyalty-based organization to a performance-based organization? Can you have both? Do you have to have one at the exclusion of another? What assumptions do we make about how we want to hold people accountable, or who's accountable? If people are not willing to examine their assumptions, oftentimes there are already self-imposed limitations about what can and can't be done in an organizational development intervention. That's why we wanted to put these up here, is for people to really, as Patrick said, dig deeper, go to the next level, and ask yourself, at our organization, what assumptions are we making about any one of these variables that are on the slide? And are they creating limited options for us before we even start about what we can and can't do?
When we do our assessments, this issue of accountability comes up often. So interestingly enough, not just from the management, but workers within a work group have a lot of concerns about accountability. Unfortunately, what we typically hear is that that other people are not accountable, and we want them, which is usually the management, to hold those people accountable. But it is a really important issue to people at all levels. But it is an assumption that people should just be accountable, that everybody's accountable for their job and their results. But it's not really always clear. So we make that assumption, well, everyone is accountable for their results. But when we dive down and we find out, and we start asking questions about authority, who has authority over decision making, who has authority over certain processes in the organization, accountability is not clear. Who's accountable? The manager for the results or the employee doing the work? There are a lot of theories that suggest it really is the manager who's ultimately accountable, and to hold employees accountable for the results is not appropriate, because the manager is really accountable for the results. The employee is accountable for doing their best to do their jobs. So again, to really challenge these assumptions might be what we can provide as an outsider, or what you might start providing internally when people come to you with challenges.
Mm-hmm.
So we wanted to look a little bit at, again, especially from our first polling question, what are your resources internally, and what types of things can you do internally, and then when do you need to get an outside consultant, such as BidPsych or other consultants? So what is the reach or capacity within your organization to facilitate assessments and interventions? So what do you currently do? I'm sure that there are all kinds of what we would consider organizational development challenges that you deal with internally, such as complaints of sexual harassment, violence in the workplace complaints, conflict between coworkers, sometimes team issues, so conflicts within a work group or lack of accountability within a work group. So all of these different things might be opportunities that you get fairly regularly to intervene. Interestingly enough, everyone that I mentioned, we have also had calls to help an organization. So we've done sexual harassment investigations when, for whatever reason, and I can give the specifics, an organization might not feel that they're in the best position to conduct that actual investigation. Violence complaints. There are times that an organization may not feel that they have the wherewithal to investigate that, so they bring us in internally. So obviously there's a lot of advantages to doing as much as you can internally. Obviously cost is a big one, because a lot of your organizations have a built-in contract for training, but when we do actual OD, we're charging at competitive OD rates. And obviously budget is a serious consideration. But there are also other advantages in that you really know intimately the culture of your organization, the process of your organization, the goals of your organization. You have a lot of intimate knowledge. So there are some advantages for you all working with some of those situations. The flip side of that same coin is that there are the same disadvantages, and that we are brought in oftentimes for specifically either for the reality or the perception of our neutrality and objectivity, that we don't have a stake in the game, that we're not part of the management team of your organization, we're not part of the leadership, we're not connected to your payroll, other than the fact that you're paying us to do this. And so people at least perceive that we're neutral and objective in how we look at situations. So it's really important for you all to say, how far does my reach go? I think it'll help when we present the case studies and as we go on the webinar series, which of these pieces and how far do you feel comfortable going, and then when, in fact, does it really pay? In other words, by pay, I mean save your organization money, time, hassle to bring in an outside consultant. And then what's involved in that? So how do you determine the right fit of the consultant? So we certainly get a lot of calls from our client organizations because we have ongoing relationships. We've worked with you around training. We've sort of been around some of the change process in your organization, the stresses and strains. So, but how do you make the right fit? We think we're almost always the right fit, but there might be situations that we're not the best consultants. I'll give you an example. We had a call from an organization, and they really wanted to do a specific type of assessment process, a state-of-the-art kind of instrument. And Marcia and I are familiar with 360 feedback, with the DISC, with the personality inventory, with a variety of tools. But I would say, and Marcia, correct me if you disagree, our strong suit is not using a lot of patented instruments. We've found better success, in our work style is to get in and really talk to people about what they need and to conclude interventions. So it might be that you really want to design a particular tool that's out there that you've heard of, and so you've got to go and find the consultant that really knows that tool and can use that tool the best.
Mm-hmm.
Do you agree with that?
Absolutely.
And then finally, what information does the consultant need? So if you get to the point that you feel like we really need to bring in someone from the outside, what's that consultant going to need to really help you? So they are going to need an honest assessment. So you have to be pretty prepared to share as much as you absolutely can, whatever the dirty laundry is of the situation that's going on. As Marcia was saying, we're going to ask you, and what we want to hear is what your particular emotional pain is. So if you're calling us as the HR representative in your organization, we want to know what's keeping you up at night and how this is impacting you in particular. And it really actually helps us to hear on an emotional level how this is impacting you, and to not externalize it to, well, these people have bad behavior and they just need to be fixed. How is this impacting you? Because how it's impacting you is how it's impacting the organization. And that gives us some guidelines to both guide the plan, but also to figure out how to help you justify some cost for the organization. So we really benefit from open and honest dialogue. We'll typically get a phone call, and then we'll set up a meeting. In our case, our initial consultations are always at no cost to just really hear about what the pain is and to see if it's a fit for us to work with your organization, what that fit might be.
Right, because we feel very strongly that if we don't feel that we are the right fit, we have no qualms about being overt about that. Our commitment is for you to get the right support that you need, and if we're not the ones, at the very least we can help you find someone depending on what you feel like you need or what you're looking for.
We certainly have done this often in conference calls. Our preference, and I would say, Marcia, that my experience is it feels like a more robust discussion, and we will come to you wherever you are and actually have a face-to-face meeting, and it feels that there's more that happens. That's not always possible, so sometimes we'll do that in a conference call, but to sit down in a room and really dive into these type of issues, because we are really looking for your emotional pain and the pain in the organization. So what are the considerations from your end? Obviously, I just talked about the pain. So what is the pain? What's the level of pain? So we'll need to talk about that. And then we have to move into the uncomfortable discussions about what's your budget for this. So oftentimes, gee, that's a stumbling block. You know, we don't really have a particular budget. As Marcia said, as much as we'd like to be proactive and preventative, the reality is most of the calls that we get are when a situation has sort of blown up.
Yeah, imploded or exploded, or either one, imploded or exploded.
And the pain has gotten so great that that there's a need to call in somebody from the outside. So you really have to look at those pain points. Again, if you have a way of intervening in the pain internally before it gets to the point that you have to call us, then maybe you can design some things that work for your organization, and it would be more preventative and proactive. But so we'll talk about budget. And as Marcia had said before, I just want to put one plug in for one of the questions that we might ask is, yeah, I understand you don't have a lot of budget, but what will it cost you not to do something at this point? So if you really look at the dollar outcome of continued poor morale, distress, low productivity, potential lawsuits, whatever might be the case, what is it costing you not to do that? And what we have found is that organizations are amazingly resilient and find, when they really need to, the resources to take care of problems. Just like if you suddenly had a nuclear reactor that was about to blow up, you just have to deal with it.
And then just to interject, another version of that budget question might be, how have you funded things like this in the past to get those creative juices flowing about where to find the resources?
Yeah, and what are your resources? So we're always happy to partner. We partner with internal organizational development consultants in organizations, with learning specialists. We partner with HR, so we're always willing to say, here's the part that you might need from us, here are the pieces of this that you can do. And we've, over the years, have been very creative with trying to help as much as we can around budget with partnering with your internal resources. You know, what are your resources for time? In other words, so if you have a fairly extensive sexual harassment investigation, does your department, or do you, if you're a solo HR person, do you have the time to actually conduct that? And then what's the decision making? So we want to be really clear who the decision makers are, and so that if we start a project, we're going to really encourage the organization to follow all the way through. Because our experience is that there's nothing worse than coming into an organization, opening things up, asking people their opinions, and then not doing anything about it. So we want to be really clear about the decision-making process all the way through. So just real quickly, in conducting an OD assessment or intervention, I think we've repeated this enough. Our first thought is do no harm. And I think that there are a lot of cases where organizational development consultants have gone into organizations and have in fact done harm. And to go into an organization and stir things up and ask people their opinions and to open up all kinds of problems, if you don't have the capacity to really deal with that and design something that helps close it up, then in some ways you are doing harm. So So that's always going to be our first and foremost motivating factor. So you have to evaluate the size and the scope of the project. So you think, are there just two people in conflict, or is this affecting other people in the team? Who all is involved? Are there problems between departments? So be very clear about, as you start designing an assessment or an intervention, who really needs to be part of this? Are there people beyond this? Is this a very specific work group, or are there other people that need to be involved? And we'll give you some examples of that in our case study. Establish the clear goals and objectives. What is it that we want from this? If it's an assessment, what are we looking for? What's the information we're looking for, and what do we want to accomplish? We're going to want to know that from you. And then what's the plan methodology? So what are we going to, what's our next step? How are we going to go about this? And how are we going to determine and execute a communication strategy to those involved so that they really understand the process? And I would say, in general, as overt as you can be about the process, the better it is. We were just involved in a project recently in which there were some overt goals stated to a particular team. There were some covert goals that they didn't want to share with the team. And that became an obstacle and a constraint. I'm not sure we could have worked around that, but it became an obstacle and a constraint in our ability to really affect this project. So what's the communication strategy? And we're often asked to supply that. So if we're going to do an assessment, we're often asked to supply what would be appropriate way of communicating what the goals are and what we're doing to the employees. And I guess I would find, Marcia, that the better the communication has been when we go in to work with a work group, the better the organization has done at communicating the goals and the process and the strategy to the employees, the better the outcome is in talking with them.
Yeah, absolutely. When it's not done well, or when it's not transparent, it's not uncommon for there to be a lot of confusion. Who are we? What are we doing? Why are we there? That can often create angst among employees and a lot of distress on a work group because they're not sure what the intended outcome is. They don't know if this is meant to be punitive. And so it actually creates inefficiencies in the process. Then when Patrick and I are meeting with these individuals, we might have to take 10 minutes out of an hour to just reframe it for them and answer those questions and tell them about the intended objectives. And it can just create a lot of distress for a work group, I think.
Great. So we've been yakking at you about theoretical stuff, and we want to get to where the rubber meets the road. And we are going to present, as we said, 3 case studies that we've spent actually a fair amount of time from all the wonderful, interesting possibilities that we've had, that we've distilled down to 3 cases that we will be using to kind of go through this process through the different webinars. These are available for us to, we've typed them up and we can send them to you along with the PowerPoint if you want this, some of the information from today. As new people join the webinars, we'll make an option for them because we're going to use these 3 case studies. The case studies are going to be a little bit less clear than ideal because we're really, again, these are private matters. This is like organizational counseling that we're doing. So we've really disguised the organizations and the situations. So, bear with us as we've tried to make this something that is really appropriate in what we share, but we think that we can learn a lot by looking at these cases.
And part of our challenge when we were putting this information together is it's not uncommon when Patrick and I start working with the clients that things continue to unfold and we get more and more interesting, useful information about the actual presenting problem. So Patrick and I had to sit down and find a way to create the presenting problem in a narrative, if you will. And so the names, we're not using any names. What I'd like to invite you to do is pay attention to the presenting problem and see if there are any themes that you can pull out, that you can relate to, that you've had experience with. So we're going to read these as narratives, and hopefully they'll be clear. We did a practice run. So I will start with the first one.
And just one other thing before you do that, Marcia, is that we also talked a lot about whether to describe to you sort of the whole process of this case. And what we settled on through some research internally with our crack HR team here. We're just going to present to you primarily the presenting problem. So when people called us and when we went and met with them, what was the situation? And then we're going to go through the other stages, as we said at the beginning of the webinar, the assessment process, the report analysis, and interventions in those succeeding webinars. So these are primarily just, this is what we get to start our plan with.
Right. So you can either envision somebody coming into your office, sharing this type of information about some of the challenges and problems that they're having, asking you for support, or you can envision yourself picking up the phone and calling us or another consultant and sharing this type of information as, okay, here's what I'm dealing with. So the first one we're going to talk about is a case study that had to do with a facility. It was an assisted living facility, and it had to deal with some of the turnover in leadership and the symptoms and pain aspects that they were experiencing as a result of that. Okay. We received a call from the key executive leaders of a company that specializes in assisted living facilities. Things came to a head 2 weeks prior to the call because a new executive director resigned just after 2 months. Prior to that, the previous director was there for a year and was terminated. And this director's predecessor had been there a long time, was beloved by many, considered extremely charismatic, and left in a less than professional manner, which had created divisions among the remaining staff. The purpose of the assessment was to identify the sources of dissatisfaction and counterproductive behaviors that were having a negative impact on morale within a specific assisted living facility. There had been work injuries, high turnover, complaints, poor satisfaction surveys, and negative feedback from disgruntled employees. In addition, a number of unresolved interpersonal conflicts had compromised trust levels and limited the staff's ability to work effectively as a team. The client wanted to know what the facility needed from corporate headquarters by way of support. They were looking to understand what was needed from the leadership team, both at the corporate level and at the specific facility. They wanted help in being able to identify the core issues and root causes of the problems that were impacting the facility, which they had surmised were low morale, fear of speaking up, and low trust levels. It's important to note that the organization was also in a period of transition due to internal and intentional cultural shifts. The facility was also in a state of transition as they found themselves in a position to have to respond to external factors such as the recession and the declining economy, new healthcare initiatives, and changes in the types of residents they were accepting. The plan as an outcome of this meeting was to do an organizational development assessment, collect data, analyze the results, and provide recommendations for moving the facility and the leadership team forward. This engagement lasted approximately 6 months.
So just one question, Marcia.
Yeah.
Did this organization, did they want to focus just on this one facility? Did they want to focus on the whole facility or a subset of that? Did they want other aspects of the organization to be assessed?
My sense, Patrick, when they first called us was to really identify this specific facility. It was one out of, let's say, 3 or 4 different campuses that they had. And this facility in particular was showing these distress symptoms around the high turnover, complaints. And so it started initially with this facility primarily.
And that was really the identified problem.
Right.
Okay, very good. So that's our first case study, and again, we're going to be following that through. Here's our second case study, and this was a direct service department of a large organization. And you know, the title that they sort of put on this in general was that there were a lot of compromised relationships and issues about accountability in this direct service department. Okay, so here was the presenting problem. The primary presenting problem for this group was that there were layers of tension and compromised relationships at all levels within the group. Several attempts had been made by the organization to address increased accountability and problem resolution with this group. The group was reportedly able to continue to provide adequate service to customers. However, in regular employee satisfaction surveys, so the organization did regular satisfaction surveys, the satisfaction scores among the department staff were significantly low in several areas over the previous 2 years. So scores that had been traditionally high in terms of satisfaction in the work environment were very low over the preceding 2 years. I want to let you know just the structure of this group because it's complicated. I think this is the best way to provide it. So the group provided direct service to the public, and it was just a department and facility of a large organization. The department was comprised of 3 essential functional groups. So the first constituent group was a group of the primary service providers who were very high-level technicians, highly educated professionals. This group of primary service technicians were contracted actually by a separate arm of the same agency. So interestingly enough, the primary providers were ultimately responsible for the quality and delivery of the services, but did not have ultimate authority for management over the rest of the staff. So that was the one group. The second constituent group was more of an intermediary service group, and a lot of their work was triaging the work by phone. And then finally, there was a third constituent group who were also a professional service support group that supported the work of that primary group. So interestingly enough, another dimension in this case was that the last 2 groups that I mentioned were each represented by their own separate unions. So there were 2 unions involved representing each one of those other groups. So therefore, reporting, accountability, decision-making, authority were complicated in this department. All of those factors were naturally complicated. Some history of this group. There had been a history of turnover and sentinel events impacting the department. Over the previous year, the lead of the primary technician group, so the direct service providers, had stepped down from that position as lead in part as a result of some conflict with a team member, and there was some controversy over that action. However, that individual remained working in the department as a provider, and that created division at various levels within the department. So alliances formed in support or against this particular person who had been in a lead position. The lead position was then assumed by 2 newer members of this same group who became co-leads of that group. There had been repeated turnover of the manager position for the other 2 support staff groups in the department. And finally, there was a new office administrator who had been hired who was taking an active role in establishing and enforcing accountabilities in the department. So some of the accountabilities, particularly that had not been really managed, were now being addressed. So the referral actually came from an internal OD consultant within the organization who had started to work with this group. For a variety of reasons, the group rejected working with this internal consultant. The consultant also reported to us that another consultant who came from the union, who was a union-sponsored trainer, had also started to work with the group, but was also rejected by the group. So BizSite was contacted by their internal organizational development department as an objective third party to assess the underlying root causes of distress in the group and to make recommendations for remedy. The goals and objectives that we were given, the stated goals were to accurately hear and understand the constituents' perspectives and focus, and to focus on solutions and to offer very specific recommendations within specific timelines. So since there had been some previous interventions, they really wanted us to be very specific about timelines and about what our recommendations were. We were also requested to get direct feedback about the office administrator's involvement in the Department Affairs. So our plan in this group was to do an organizational assessment based on individual interviews with all of the department staff. The project then also involved consulting with and obtaining buy-in from all the union sponsors at all levels of the project. So very important to recognize that if you have a union in your organization, you really need to work with the union, especially if you're going to be dealing with their members in some kind of intervention process. I think this project lasted 6 to 9 months overall.
So case study 1 and case study 2 were typical types of organizational development interventions that we work on. The request came in a predictable manner of how we usually work with our work with our clients, this one case study, the last one, is a little atypical of how we started working with this group. So here goes. All right, this has to do with a private practice. Initially, this engagement started by working with the owners of a private practice who were having some internal conflict. Specifically, they were considering ousting one of the owners due to concerns about a poor fit and a lack of trust. We had agreed to facilitate a group meeting with the 4 owners and the CEO, who was a part of the equation, to help them determine how to proceed forward and whether or not this owner should remain with the practice. The CEO was part of the equation because 6 months prior, 3 of the owners had confronted the CEO about his drinking problem, and the intervention failed miserably. Part of the consternation with the one owner that who at this time was considered the poor fit was largely due to the fact that this owner was calling attention to significant problems that were caused by the CEO's inability to perform the functions of his job. In addition, he had put the company at risk for potential lawsuits due to inappropriate behavior. Already, one formal complaint had been filed regarding a situation involving sexual harassment with an employee. The culture of this company was relationship-based and rewarded loyalty. The one owner that was calling attention to the problems created by the CEO was considered unfeeling and distrusting, actually, and not loyal. This owner was eventually demoted from the position of a director because it was believed that this owner was micromanaging. This was the same owner that the others were considering ousting, and the concern about this owner was the main reason for our initial consultation. During the same time, there were reports of serious concerns regarding the relationship between the CEO and one of the department managers. This particular manager was viewed as volatile, behaviorally inappropriate, and threatening. There were reports of this manager being intoxicated and sexually inappropriate at business events and with vendors. As a result of her relationship with the CEO, many felt she was actually influencing decisions and receiving preferential treatment. Because of her close relationship with the CEO, she was protected and insulated by the same blind loyalty that 3 of the owners offered to the CEO. The organization was in complete chaos. Other factors that were contributing to the company's problems included poor morale, collapse of people's roles, inappropriate and or ill-defined scope of authority for individuals in management roles, money that was being left on the table, financials that were not being reconciled, policies and procedures that were completely outdated, reports of unethical practices that could jeopardize the business, and the company was at risk for various lawsuits.
So after hearing that, you all should feel probably pretty good about your organizations and how they're doing. So we hope that we've whet your appetite with these case scenarios. Again, we're happy to send them to you if you need a little more time just to read them again. We had to put in enough detail, but not too much. In all the cases, we could have put 4 times more detail in, I'm sure. So we hope that we've whet your appetite around looking at organizational issues in organizations. Our next session, we're going to really talk about what's the next step, the assessment process of how to start really assessing what is happening in the organization and what's needed. And we would very much welcome your feedback on today's presentation, your questions, your comments, your shared experiences. And again, we would commit to dealing with those, obviously, diplomatically if you want us to share or answer questions. I'm going to check real quick and see if there are any questions. I don't see that there are any questions from any of you all. We want to honor your time and be on time for closing the webinar. Our contact information right there, you certainly can contact us, as we said, with feedback, questions, comments, or if you merely want the PowerPoint, we're happy to send that to you from today's webinar. We will send out another invitation reminder, and again, we'll solicit your feedback and questions about the assessment, which is our next webinar. What do you think you'd like to find out if you did an assessment? What are the types of questions, or what's the type of process that you would like to see? So we welcome any feedback and questions that you have.
Including what have you done when you've done your own assessments? What tools have you used? So we look forward to continuing this series with you.
And we will look